group, among other hospitals. In the red corner, we have our very own Dr. Nabila, who is also a psychiatrist, working also at the Chiromo Hospital Group, fighting in her corner with our very own president, Dr. Chitai. Now, to kick us off this morning, ladies and gentlemen, at exactly, the format is that each speaker will have 6 minutes introduction, and at the end, we'll have another 3 minutes for closing remarks. We will have first Dr. Amadi, who is starting to speak at exactly 8:35. Dr. Amadi?
Thank you so much. Thank you. Thank you so much. Thank you so much, Dr. It's with a great honor that I take this opportunity to be part of the Blue Corner. In being part of the Blue Corner in proposing the motion that the House believes that due to the nature of our workers, health workers, we are at an increased risk of ill health and including suicide. The brief points that I'll be talking about, just to mention them, so that in my delivery to expound on the motion and on my points, you'll gladly remember the main points that I had noted. One would be the weight of our responsibility. Two, the benevolence of non-malfeasance. Three, mganga hajigangi. Four, that health workers are only human. So to start us off on the weight of our responsibility as healthcare workers is that a responsibility is a state of having duty to deal or control over. Indeed, this comes about with the knowledge, skill, and experience in our practice in the management of our patients. And therefore, this dictates that regardless of how healthcare workers feel or in the state that they are, that we are expected to be laser sharp in our judgment and actions. And the expected margin of error is almost zero, as it should be. However, the sustained demands and overwhelming workload, long hours, and the culture of service and sacrifice, the high clientele expectation and peculiar problems that health workers are exposed to, including hazards in our workplaces, can lead to an impaired work-life integration. And certainly, this will weigh on anyone, and the increased risk to stress, anxiety, and also other health issues, including but not limited to cardiac ailments, sorry. The cumulative experience of stress, rather than just an acute traumatic episode and emotional labor of the healthcare worker, where they have to regulate their emotions and remain professional. In this regard, we could say that they would probably be wearing a professional mask due to the high demands from the corporate structure of healthcare, as well as the demands from patients and the expectations from just the patients as well as the caregivers can increasingly increase the risk of psychological problems to the healthcare worker. And indeed, this weight of responsibility has a great impact on how the health worker is health-wise. To my second point, on the benevolence of non-malfeasance. Non-malfeasance means that you do no harm, part of which is indeed a part of the ethos that we as healthcare workers hold on to, that in our humanity and generosity in doing no harm to our patients, regardless of its impact to us, like being exposed to communicable diseases, healthcare workers are at risk, particularly with are definitely at risk in contracting communicable diseases which was evident even in the wake of the pandemic. Healthcare workers, of course, are always on the front line, even when things are not fully understood. And indeed, it has been reported that there is a strong association between exposure to stresses of the pandemic and the subsequent development of depression, anxiety, post-traumatic stress disorders among healthcare workers. Simply because that we as healthcare providers we actually prioritize the health of patients over ourselves, and therefore coming to a point where we at times sacrifice our lives to save the lives of our patients. On to the third point, kweli mganga hajigangi. If you were to go to a barber shop, and this is an analogy that I like to use a lot, if you to go to a barber shop or
One
to a
minute,
hair,
Dr. Amadi, 1 minute,
yeah,
go on.
yes, or to a hairdresser, and you like the hairdo on them, you would certainly want to choose the person who did their hairdo, because the person who did the hairdo is not actually the hairdresser that you're looking at. We indeed, the healthcare workers, are the worst consumers of our services and hardly take time to take stock of our health. Well, sorry about that. And certainly we don't take stock of our health. And as Galen, the Greek physician, said, between 130 to 200 AD, that physicians will hardly give careful thought of their health, that the physician who hardly give careful thought of their health, the physicians will hardly give careful thought of the health of his patients if he neglects his own.
Very much, Dr. Amadi. That's very, very good. Well done. Thank you very much.
Thank you. Thank you.
Thank you very much. We now move on to the red corner, where the erstwhile Dr. Nabila will start her presentation for 6 minutes, starting now. Dr. Nabila?
Yes, good morning, everyone. Thank you, Dr. Njenga. I'd like to, and I'm happy to be on the red corner, I must say. I'll start by thanking the Chiromo team for organizing this debate. It is a very important debate as it affects each one of us here. No one denies the fact that as health workers, we are at a greater risk of ill health as compared to the general population. And me and Dr. Chitai are here to broaden the House's perspective from a narrow way of looking at it to a more comprehensive way. And we are saying it's not only the nature of our work that puts us at risk of ill health, but we have other very crucial factors that sets up the baseline or a foundation for a specific individual health worker to be at risk of either a mental or a physical illness. So without wasting a lot of time, I'll list the factors that we believe carry more weight than just the nature of our work as health workers. So the first one will be genetic predisposition. So research has shown that genetic predispositions increase an individual's likelihood of developing certain physical and mental illnesses. And health workers are not an exception to this fact. These predispositions can interact with occupational stressors, potentially heightening their risk for various health issues. Therefore, health workers with genetic predispositions to certain physical and mental illnesses are at an increased risk when these genetic factors interact with occupational stressors. Then the argument that the nature of healthcare work alone increases the risk of ill health overlooks the role of individual factors, such as personal life circumstances, pre-existing mental health conditions or physical health conditions, and personality traits. So these factors can significantly influence a healthcare worker's risk of ill health, suggesting that the work environment is not the sole contributor. So we see certain personality traits such as perfectionism, a strong sense of responsibility, and a tendency towards self-criticism. These personality traits are more common in health workers, and these personality traits contribute to chronic stress, feeling of inadequacy, emotional exhaustion, burnout, and mental illnesses if not managed properly. Then individuals with lower resilience or maladaptive coping strategies are more susceptible to mental health problems. Therefore, health workers with lower resilience and with maladaptive coping strategies are at a higher risk of an illness. Then we also look at parenting style. Yeah, the different styles of nurturing children, particularly during their formative years, can have a long-lasting effect on their psychological development, emotional regulation, and resilience again. These effects can persist into adulthood, influencing how individuals cope with stress, manage relationship, and maintain mental health. For those healthcare workers whose profession inherently involves high stress, the impact of their upbringing can either exacerbate or mitigate the risk of ill health. So the style of nurturing that healthcare workers experienced in their childhood can significantly influence their mental health and ability to cope with the demands of their profession. So these parenting styles, authoritarian, permissive, neglectful parenting, these styles are associated with poorer mental health outcomes, which can increase the risk of burnout and other health issues in healthcare workers. Attachment styles are also important to look at. So attachment styles formed in early childhood through interactions with caregivers play a significant role in shaping how individuals manage relationships, cope with stress, and maintain mental health throughout their life. So secure attachment provides a strong foundation for mental resilience, while insecure attachment styles can increase vulnerability to stress, burnout, and mental health issues. So for those healthcare workers whose professions are inherently, again, stressful and relational, their attachment styles can profoundly impact their well-being and their risk of ill health, including mental health challenges. The last point I want to mention is adverse childhood experiences, which can significantly increase the risk of ill health among healthcare workers.
1 minute,
Yes.
Nabila.
Thank you. Yeah, so adverse childhood experiences can increase significantly the risk of ill health among healthcare workers, affecting both their physical and mental well-being. And this includes various forms of childhood trauma, such as abuse, neglect, and household dysfunction. The long-term impact of adverse childhood experiences can manifest in adulthood, particularly in high-stress professions like health care. The cumulative effect of adverse childhood experience and the high-stress nature of healthcare work creates a perfect storm for increased risk of ill health, highlighting the need of targeted support and interventions for healthcare workers with a history of childhood trauma. Thank you, Dr. Njenga. Back to you.
Oh, well done, Nabila. You have 30 seconds to spare, which is will be kept for use another day by the moderator for this morning.
Thank you.
That now brings us squarely to Dr. Kibuti. In the blue corner, Dr. Kibuti, you have 6 minutes.
Thank you. Thank you, Dr. Njenga, and thank you for this debate. Let me start by saying with a disclosure that this is my first ever debate, and I believe that my debate inexperience will not cost us this motion that state that this House believes that due to the nature of their work, healthcare workers are at an increasing risk of ill health, including suicide. Let me first remind you that no one is immune to physical and mental illnesses, and career or occupation does not protect one from mental illnesses. As long as you have a body, a brain, and a mind, you can suffer from physical and mental illnesses. However, we know that some careers, especially the healthcare profession, actually predisposes people to ill health and mental illnesses. Healthcare workers have been given an opportunity of witnessing and participating in the beginning of life, the suffering brought about by ill health, and the end of life, which all are distressing moments which can cause trauma to healthcare workers. But on the flip side is that the experience and the knowledge that the healthcare workers have, they can make them cope better compared with the other individuals in the society, cope better with illnesses. When we come to suicide, we know that those at the risk of dying by suicide are people in certain professions, such as the police officers, and the healthcare workers have not been left behind. So they are part of it. And those people who work with terminally ill patients and people with substance use problems, which is a big issue with the research that was recently done about the healthcare workers. People with a history of physical and emotional abuse and sexual abuse also are some of the people that do involved in suicide. And we know some risk factors for committing suicide is availability of means to take one's life. And I don't know whether there is anybody who has available means more than the police and the healthcare workers. When you look at the substance use, of course, it's been a concern about the healthcare workers. And we know that substance use comes with a lot of mental and physical health issues. And studies indicate that significant percentage of healthcare providers misuse drugs at some point in their lives, including alcohol, tobacco, marijuana, benzodiazepines, which are commonly abused substances. When you ask ourselves, and even the World Health Organization recognizes work as a major source of physical and mental health, workers in the healthcare industry face some of the most challenging working conditions of any industry. And some of the risks that are included are the long hours, the staffing shortages, and the exposure to violence and harassment, exposure to hazardous drugs, infectious diseases, and high stress levels, emotionally charged situations, and seeing many things. And the job burnout. I've seen quite burnout amongst ourselves. And we know that job-related factors such as the wages, the heavy workload, and interaction with co-workers and supervisors sometimes also brings about this distress. When you look at the healthcare workers also, they have a great chance of being exposed to night shifts, and our bodies are not used to working at night. And there frequently, they get issues with sleep. They experience sleep problems, and of course, they lead to burnout, depression, anxiety, and other psychiatric disorders. When you look at sleep and mental health, we know that sleep and mental health are closely related, and living with a mental health condition can affect your sleep, and also poor sleep can affect your mental health. Lack of sleep can also make us physically unwell, and it's linked to heart disease, diabetes, and premature aging and road accidents because of not sleeping at night when you work at night. When you look at our rate of workplace violence, I think this is something that we need to address because it's a global concern that poses major threat to healthcare professionals, mainly by patients or the relatives of the friends. It impacts on the physical and mental health of healthcare workers, and thereby the standard of care provided to these patients sometimes gets compromised. So the healthcare profession is particularly susceptible to violence because sometimes you get very uncooperative patients, confused, and sometimes they are under influence. And furthermore, we know the demanding—
1 minute, Dr. Kibuti.
Yeah, the demanding nature of our healthcare worker, long hours, get us stressed. And sometimes when you're supposed to get an agitated patient and you're supposed to de-escalate, you're not even in the mood or in the mental space of this escalating. And this might lead to verbal, emotional, and violence, and sometimes even sexual harassment from the patient. So I think the other thing to say is that physical health problems, we have, and they increased developing mental health issues and vice versa. And nearly 1 in every 3 people with long-term physical health condition also has a mental health condition, and often depression and anxiety. So research has shown that people with mental health issues are likely to have a preventable physical health conditions such as heart disease, stroke, and type 2 diabetes. Thank you.
Allow me to now introduce our own president in the red corner, Dr. Chitai.
Thank you, Chair. So I'll go straight to my points, and I'll start by discounting the point by Dr. Kibuti about the issues around the workplace. So that's one of our points, that the workplace culture is not necessarily about the nature of our work, because workplace challenges are in many places, and bad bosses are everywhere, almost everywhere. and the worst maybe are not in the health sector. Remember, in our health sector, we have a chance where we can question, where we have very properly constituted disciplinaries, and so we have maybe a greater leeway. Just compare with maybe uniformed forces, and you realize that this workplace culture, while we need to address it, it's not only in our industry. My second point is on economic pressures as a contributor to our ill health and suicide. So issues of high dependency. Remember, we are in Africa and we are exposed to things like black tax, fundraisings, loans to pay, some of them help, and also peer pressure. So these economic pressures are some of the contributors to our ill health rather than just the nature of our work. And then adequate mental health resources. So if a health worker came out and they wanted to access health services, both health, general health and mental health, the question is, where will they go? So we don't have many specialists in the healthcare of health workers, and that itself is a major challenge. And then we like to also argue that being health workers, there are certain protective factors that we enjoy that others don't because of the nature of our training. So one of the factors that protect us against ill health and mental health is high levels of health literacy, and including mental health literacy. So health literacy is associated with health-related lifestyles, such as exercise, good nutrition, decreased substance use, and adequate sleep. And this has been studied in multiple studies, the latest in 2024 by Kinoshita. And these are protective factors, which then leads to reduced incidences of cardiovascular diseases, cancer, mental health disorders, many of these non-communicable diseases. Another protective factors is that our skills are highly valued. A doctor can work in any country. If Kenya is not working for you, you can move to another country, get a job. So we have our valued skills ensures that we have better job security than maybe our comrades or our friends from other areas. Also, which results in just high levels of employment. So generally, although there are problems recently, but generally we can agree that there are less unemployed health workers than workers in other sectors. And then social value of the health work. So the social value of the health work, the satisfaction we get from reducing the pain of our patients is of extreme value. And helping people, end their pain, reduce disability, go back to functionality, all this is very important, and this gives us high value. And of course, many of us may have met people who are just distressed because they don't think that the value of their work is very high. And so our argument is that we need to give a comprehensive approach to the complex issues that affect the health of health workers, rather than just focusing only on the nature of work. Back to you, Chair.
Oh, well done, Mr. President. You have given the moderator 2 extra minutes to do whatever he wills with it. And this is what he will do with the 2 minutes donated by the president, is to, before I hand over to Dr. Zawadi, I'd like to explain again, if I may, that this debate is phrased very, very carefully and is intended to address, number one, not the entire workforce in the world, but only healthcare workers. There is no discrimination between doctors, nurses, psychologists, or any. It's healthcare workers in general. In discussing this matter, I think it's important to appreciate that not all healthcare workers are exposed to identical health challenges arising from the nature of their work. Similarly, and in conversation here with respect to today's debate, the word increasing risk needs to be addressed specifically, because what we are really thinking about is there any evidence of increasing risk? Because if indeed there is increasing risk, we need to appreciate what was working before and what is working now, if we are going to mitigate. And finally, we need to look at the nature of this increasing risk. Is the increasing risk essentially low rate of work? Is the increasing risk related to morbidity or to mortality? And if to mortality, is there evidence of an increasing risk of mortality due to risk? With that description, I now hand over back to Zawadi, who will take us to the next section of this conversation. Back to you, Zawadi, and I will be taking the microphone away from you at 9:15.
Thank you very much, Dr. Njenga. And thank you very much to our esteemed panelists. Good job to everyone. Now we are going to move directly into the question and answer segment, where all of you are encouraged to key in your questions on the chat box, and we'll have a few people giving some commentaries surrounding the conversation that we have just had today. So without further ado, I would like, first of all, to just get some input from Dr. Nyamiobo about his thoughts surrounding this motion and this matter. Dr. Joseph?
Thank you very much. Yeah, this is a very great presentation. Thank you very much for hosting this debate. My input would be that healthcare workers are probably at an increased risk of developing mental health conditions. And this has been, in my opinion, increasing over the years. This increase over the years, from the top of my head, would be that the causes of this increased risk could be an increase in awareness of mental health and mental ill health, meaning that yourself as a physician also have noted some of the symptomatology in yourself. Also, the fact that there is an increase in need of ourselves as healthcare workers to give our support to the increase in demands. And this is not proportionate to the number of healthcare workers that are coming in place. So that would be my reasoning for an increase in risk. And essentially, it will lead to increased morbidity and mortality. Thank you very much, Zawadi.
Thank you very much, Dr. Joseph. From the chat box, I can see there are a few comments. One of the comments is that there is insufficient support systems in place for healthcare workers, making it difficult for them to seek help for their own health issues. Now, this particular statement seems a little bit like a question of sorts, and I would like our panelists to try and address whether there is actually insufficient support systems in place for healthcare workers. And this question, I think I would like to direct it to people who are opposing this particular motion. Anyone
They will address they will address this at the end when they will have 3 minutes. Yes.
Okay, no problem. And equally, so there's another statement on there's an element of work satisfaction that puts workers at risk. So those are the two commentaries that are coming to my desk as we speak. I would like to invite Dr. Musheru, if we still have her on the call, to give a comment about this particular conversation.
Good morning, everyone.
Morning.
This is a lively discussion or debate, which I would say for me is a seesaw. So the fact that you're a doctor, you're human first before you became a doctor. So we can't quite iron out and say that the fact that you're a doctor is what makes you sick. But as a doctor, there are the inherent risks, like the people in the red corner highlighted. And the nature of our work is also demanding, but we have been trained to deal with this demanding job, and it's our capability, it's within our means to improve our knowledge and skills and to have some level of resilience. So for me, I would still say it's a seesaw and would need to look at it from the fact that we are doctors, yes, but before we became doctors, we are human. Thank you.
Thank you very much, Dr. Musheru. Equally so, I would like to invite Dr. Catherine Siengo to give a comment about this particular conversation. Dr. Siengo, do we still have you on the call?
Good morning, everyone.
Morning.
Yes, just to support that, as healthcare workers, we have to, at every step, stop to evaluate our own health and see whether there's something we need to do more or there's something else we need to reduce, and keep listening to our bodies and our emotions. Thanks.
Thank you very much, Dr. Siengo. I know that we are joined by Dr. Angela Mundi from overseas. Dr. Mundi, would like to hear your comments about this conversation surrounding the wellness of healthcare workers.
Good morning, everyone.
Morning.
First of all, thank you for inviting me to this debate. It is, like the others have said, a necessary conversation in our work. I stand with the other corner that says healthcare workers are at an increased risk of ill health due to the nature of their work. This is supported by a number of studies that have been done by different organizations, including the American Psychiatric Associations. There are small other organizations that have done studies, one of which shows that there's an increase of about 6% in ill health in healthcare workers in general. This was a study that was done in the UK and not just limited to mental health. This is a study that was done, and the 6% was during the period of 2021 to 2022. This was mainly so that they can see whether we are having an increase in ill health in existing illnesses and also new illnesses. And it was not limited to the fact that COVID has also really impacted how people are able to take care of themselves, especially healthcare workers. So in view of this, I stand with the other team which says that we are at an increased risk. Thank you.
Thank you very much, Dr. Amundi. I think it would be good if at some point you could share that particular study so that you can share with colleagues to help inform them on some of these variables and how potentially they may be able to help themselves or help someone else out. As our panel continues to prepare for, addressing some of the questions that are coming in, we have a question on, we have a comment that it is difficult to reach out to colleagues as a healthcare worker, especially in the event that someone is going through a mental health issue. And that, again, to some extent, may increase the risk that a healthcare worker would experience. There's another comment that reads, healthcare workers experience emotional burden of caring for patients, especially those with chronic relapsing illnesses, hence leading to compassion, fatigue, and mental health issues. Working long hours and having challenges in having a work-life balance only compounds the problem. There's another comment that reads, healthcare systems must implement regular psychological debriefs, resilience training, and regular wellness checks for clinicians to prevent compassion fatigue, emotional depletion, and the burnout syndrome that stems from chronic overextension? And then can systemic changes in work environment, such as reduced work hours or significantly reduce risk of ill health and suicide among healthcare workers? I think especially in line with this particular conversation, we also need to incorporate the role of like nurses and all of these other supportive structures that facilitate the healthcare system. Quite a lot of comments coming along. They will be addressed in the next few. So we also have a comment from Gladys, which means we need to address all this from a point of humanistic perspective. Of course, you're predisposed to all kinds of illnesses, but what on work culture can ease the burden. And then we have the stress of making critical conditions, often with limited time and resources, can significantly put mental and emotional strain. Corruption is also playing a role in frustrating the innocent ones. So keep having your comments streaming in as we carry on with this question and answer segment. But as we continue to proceed, I think I saw Dr. Jacqueline Ocheng on this particular call. I don't know whether I still have you. Maybe you can give us a comment or a question surrounding the conversation that we are having today. Dr. Jacqueline?
Yes, good morning. Thank you so much for the opportunity to just put in a comment. One thing that we appreciate about the exposure and the risk that we have as healthcare workers towards illnesses and perhaps mental health issues, it's really upon the workplaces, because I remember last year we launched the workplace mental wellness guidelines, and I think it's high time that each organization or each institution came up with a comprehensive way to take care of their healthcare workers. And it may not necessarily just be mental wellness, but overall wellness. So even in the part of the organizations, we also need to play a part to take care of our healthcare workers, given the fact that we also know that there's an increased risk for that. That is what I would say.
Thank you very much, Dr. Ching. I'm equally informed that we are joined by care managers from insurances, as well as HR professionals in the wellness departments of several organizations. Thank you very much for joining us in this conversation. Now, I think I would like to hear from a nurse, and to this effect, I would like to call upon Evelyn Araka, who is a nurse with the trauma hospital team, so that she can give us, her views from a nursing point of view surrounding this conversation. Sister Araka, are you there? Okay, I cannot seem to get her. So we will proceed on, and I would like to ask a psychologist from our team in the retreat to give a comment now more from a psychologist's point of view, because psychologists equally experience significant distress and discomfort in the course of work. So Joy, are you there? Joy or Mercy, any of you can take this particular one, because we have 1 minute before I am chased from the floor. Alrighty, so I think I will hand over back to Dr. Njenga. I have spared us 1 minute so that the conversation can progress on.
I have to thank you, Zawadi. You have given me 1 minute. Mr. President gave me 2 minutes, and Dr. Kibuchi gave me 1. So I have the privilege of being able to say 1 or 2 things, which include something I have already said, that the framing of today's conversation is very deliberately done. First of all, we need to be clear that it is the nature of the work of healthcare workers, not their genetic makeup, not whether they are well paid or not. It is the nature of the job that is a problem, number one. Number two, and here I'm speaking to those in the red and in the blue corner, we need to be clear that there is an actual increasing risk. We know, and I'll demonstrate this in a minute, that there is high risk. But you need to demonstrate to us one way or the other that there is increasing risk to healthcare workers. And finally, that risk must be exemplified, at least in part, with regard to this very important matter of suicide. Before I ask the speakers in the respective corners to give us 3 minutes of their summary, this morning I am going to be addressing the Kenya Society of Anesthesiologists, at their request, if I may add. And so I have had an opportunity to look around the subject of mental health and, at the very least, anesthetists. I will just say 3 things and then almost to illustrate the point. The first one, if you hear that a doctor has an addiction to an opioid in America, chances are that it will be an anesthetist. 75% of the doctors who have problems with opioids are actually anesthetists. The reason for that, and this is where I'm describing the nature of work, is that the anesthetists have something called second-hand exposure to the anesthetics that they give, because they work so near the mouth of their patients. They are exposed to whatever anesthetic they are given. And this has been shown quite well by a genius of a recent study that studied the extent of contamination of the air around the mouth of the patient, compared it with the rest of theater, and compared it to the corridors around the theaters. So as far as the anesthetists go, and I know this only because I have been looking it up, the nature of the work of an anesthetist exposes them to additional risk. And I think, and I will address Dr. Kibuti with our permission, the nature of a debate in general is about being very clear and specific about the way the debate itself is framed. So I will now go in reverse order and ask Dr. Nabila in the blue corner to go first. And Dr. Nabila, you have 3 minutes starting from now.
Thank you so much, Dr. Njenga. So maybe if I can attempt to answer your question very briefly, I would say that research has shown evidence that there has been an increase of the incidence of ill health among health workers post-COVID, that is, and partly due to maybe the technological changes that COVID exposed us to. Maybe just to briefly also say something about the insufficient support system in workplaces. I would think this depends on depends where this specific health workers works. Yeah, so there are places, workplaces that have considered supporting health workers sufficiently. So in closing, I will just say that as we have heard, it is evident that while the nature of healthcare work undeniably contributes to the risk of ill health. So as you know, from the red corner, we are saying, yes, the nature of our work can increase the risk of ill health among health workers, but we are saying it is not the sole factor. So we have so many other factors that we have mentioned, including genetic predispositions, personal experiences, parenting and attachment styles, adverse childhood experiences, and workplace dynamics. All together, these factors play a significant role in increasing health workers' risk of ill health. If we narrowly look at the nature of our work as the only culprit, then we are losing focus and we will miss out on important interventions to help support health workers' well-being. So I'm therefore urging the House to vote against the motion and join the red team so that we can work together to tackle these multifaceted risk factors. We must holistically approach this issue by combining workplace reforms, mental health support for health workers, and acknowledge the broader context in which health workers operate. If we don't incorporate all these factors we have just mentioned into our planning, we will not be able to protect our future health workers in having resilience and adopting healthy coping mechanisms to tackle challenges and maintain well-being. Thank you.
Thank you, Nabila. Congratulations and well done.
Thank you.
Dr. Amadi, closing remarks.
Thank you so much, Chair. Thank you so much, Chair. Indeed, there's been increased risk amongst our healthcare workers towards ill health, including suicide. And to support this motion, one of the things is the cumulative stress experienced by healthcare workers. And indeed, rather than just being exposed to just acute traumatic episodes, healthcare workers go through a lot of emotional labor in managing themselves and their emotions to the extent that they have to put on a mask to take care of their patients. And this cumulative stress, of course, will have an increase, a great impact in how they are and towards their health psychologically and physically or otherwise. Indeed, the next point would be that we are poor consumers of our services, studies support the fact that doctors or healthcare workers do not take care of their own health any better than is expected. Some studies report that doctors actually take fewer vaccinations, are careless about controlling their cardiovascular risk factors, and receive fewer screening tests for cancer than the general population. And the healthcare workers are also amongst the community. I'm from amongst the community, and we live and interact with the community. So we are human first. The risk that the community is exposed to, the health workers are also exposed to. In fact, many of the health workers lose sight on their own personal health and well-being while they confront the stresses within their workplaces, including the increased workload, the rapidly increasing knowledge base, the increased government regulations, such as e-teams, malpractice suits, and the balance of work-life balance or life-work integration. Indeed, the benevolence of malfeasance in doing no harm ethos has led to healthcare workers prioritizing their patients over themselves. And indeed, that is how it's supposed to be. But this has an impact on how the healthcare worker is, and in totality, cumulatively over time, it will definitely be detrimental to their health, mental and physical. Thank you, Chair.
Thank you, Dr. Amadi. Well done. Well done. Exactly on time. We now move on to Mr. President. Mr. President, closing remarks.
Okay. So thank you, Chair. I would like to re-emphasize a few points, but first I'll start by addressing the issue of increasing risk. it's difficult. We've not seen any evidence that actually the risk is increasing, and have not come across any study. But from first principles, if you compare the Kenyan healthcare landscape 14 years ago and now, there is reason to believe that actually these risk factors that predispose us to ill health may have decreased in certain aspects. One is that the numbers of healthcare workers, if I use the example of doctors, the number of doctors in the public health sector has increased by about 8 times the number of doctors in the public health sector. Right now, we are talking about 9,000. 14 years ago, it was about 8 times less. And that means that the workload may also have decreased. If you look at payment, in as much as we still have issues with payment, but our payment as doctors has increased 3 times if you compare 2010 and now. And that also means that there is, greater satisfaction with our work. Going through just the other points that may have been said before, I would like to emphasize that one, apart from physician healing thyself, which is a common advice we give, we also should emphasize that physician know thyself. So know your personal risk factors and try to mitigate them at a personal level. Number two, the economic pressures that come from society. We may not have much power to control them, but we must be aware, and there must be some certain level of correcting the myth in the society that the doctor, has all endless resources, as the society may think out there, and therefore they must also get that to understand and reduce the pressure and expectation on the doctor. There must be something that must be done about inadequate mental health resources for health workers. It's an issue that still is outstanding. We don't have good enough programs that address health issues of health workers, which ties into the workplace culture of mental health. Unfortunately, hospitals are lagging behind. And this is not an issue to do with nature of our work, but nature of our workplaces. That hospitals as a workplace have not taken the lead. They're like the other workplaces, and unfortunately at the detriment of health workers. And lastly, we should leverage more on our protective factors as health workers. And that may include things like increasing our skills to do our job, but also rewarding health workers who excel in their work. And of course, the issue of remuneration, it must still be improved to match the best in the world.
Thank you, Mr. President. Thank you, Mr. President. We now go back to Dr. Kibuti for her closing remarks, and that will bring us to the end of the morning's conversation. Dr. Kibuti.
Thank you, Chair. What I would want to say is that I've seen some comments about people commenting about workplace, and I will say that we spend, I think, 75% of our time at workplace, 8 hours each day or more. And we know that certain workplace policies and practices can promote our well-being, especially when we work in supportive environment. And aspect of supportive environment sometimes include participation in workplace decisions, trust between management and workers, proactive and helpful supervisors that usually promote stress prevention. They help with the psychological health of their people, support for productivity, and create a harassment-free workplace, and of course, give their workers enough time to complete their task. Moving swiftly to what our president has said, that the numbers in the health sector has increased, the pay has increased. I think the challenges that are being experienced in the public sector are not similar to what is in the private sector, because you might be many, you might have high pay, but then you have nothing to work with. You have no gloves, you have no oxygen, so the frustration is still evident. Lastly, I want to say that us as healthcare workers, we have to practice self-care that can play a role in maintaining our mental health and support our treatment in case any of us has mental illness. And self-care are just some of the things you do to help you live well and improve your physical and mental health. And it includes just getting 30 minutes of exercise every morning or every evening or whatever time that you have. And exercise is not going to the gym, it's even stepping out of your desk and walking for 5 minutes and back to your desk. Make sure that you eat healthy, regular meals and stay hydrated with water, not coffee or caffeine. and make sleep a priority. I said that healthcare workers suffer from sleep. Make sure you're sleeping enough. Try any activity that can relax your muscles and relax your mind. Set your goals and priority. Make sure you know when to say no, when you can't take up a new task, and so that you have time to complete what you have. Practice gratitude. This world is very cruel. Learn to say thank you for the little positive things that happens to your life. And of course, let's always focus on positivity and identify our challenges. And most importantly, let us stay connected. Let's stay connected to our colleagues and even our relatives who can provide emotional support and practical help when you're feeling stuck. So thank you. I hope you support this motion that indeed being healthcare workers and what we almost go through day-to-day factors and dealing with human beings is hard and can predispose us to both physical and mental illnesses. Thank you.
Oh my goodness me. Makofi kwa kila mtu. Makofi for Dr. Kibuti, Dr. Amadi, Dr. Nabila, and our very own president. Thank you so much. Now, before I hand over back to our convener, I have to say that this series of debate was conceived for the purpose of enabling the mental health fraternity to deliberate on current and important matters. I think this morning I counted over 250 participants in this debate. I think that's a good number for any class. And I would like to encourage you, Zawadi, for the next debate, which I presume will be in December, to do what you have done today, which is to bring together a diverse group of people to discuss whatever subject is current at the time. Let me say this also, Zawadi, that in the Kenyan spirit of public participation, perhaps you could encourage your constituency, our constituency, to participate in the formulation of the discussion that we will have in December. Once again, Dr. Amadi, Dr. Kibuti, Nabila, and Mr. President, thank you for your time. And I think we all live to go back to our places of work, if not wiser, certainly better informed. Thank you very much. Back to you, Zawadi.
Thank you very much, Dr. Njenga. Thank you very much, Dr. Njenga. I am having a technical glitch on my end, and therefore I'm unable to access the poll that we would use to poll to see what we after being privy to this conversation, what we feel about the
Zawadi, maybe you can do what they do in Parliament.
like, first of all, to
Zawadi, if you can't get the actual quantitative numbers, maybe you can get everybody to turn on their mics, and all those who say aye will shout aye. Those who say nay, that's what they do in Parliament, and it works. That's how to deal with this technical problem. Go on.
Okay, so I think that's a very, very good idea. So what we will do, we will have all of, but I can see that now my gadgets are working. Nevertheless, I like your idea better. So what we will do, we will have everyone turn on their mics in the event that they agree. Let me bring up the poll so that I can read it as is. So the poll reads, do you agree that healthcare workers are at an increasing risk of ill health due to the nature of their work? All who agree with this can turn on their mics and just say aye, and all who disagree can turn on their mics and say nay. So we start with the ayes. Do you agree that healthcare workers are at an increasing risk of ill health due to the nature of their work? All who say aye, go
Aye.
ahead.
Aye.
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 Okay.
Aye.
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 Okay.
Aye.
Aye.
All right. And those who disagree with this particular statement can now say nay.
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 Okay.
Oh, all right, the eyes have it. Thank you very
I
much.
think the ayes have it. So with this, we would like to thank you all very, very much for joining us in this conversation. I would particularly like to give very special thanks to our panelists, Dr. Nabila, Dr. Madi, Dr. Chitai, and Dr. Kibuti, as well as our chair and moderator for today, Dr. Njenga. A very special nod to all of our esteemed guests, because today we had quite a number of guests. Thank you very much. I would like to once again invite you for our next grand round, which the invites of it shall be shared to you in the ways and in the format that was shared before. So thank you very, very much. Have yourselves a pleasant day, and remember to take care of yourselves and take care of each other. Asanteni sana.